In an emergency, it's vital for medical staff to know about a patient's medications and allergies. The introduction of summary care records aims to improve the electronic sharing of this information within the health service.
At the moment, it's impossible for clinicians in out-of-hours and A&E settings to access information about what GPs have been doing for their patients in an electronic way. This project is an attempt to actually make sure that the key information that clinicians tell us they need to have will be available when they're seeing patients in all out-of-hours settings.
I think in our role in particular, because we deal with acute emergencies most of the time, having patients' records in one place, easy to read, would be enormously useful. Often in healthcare settings, the person that's treating the patient or caring for the patient knows that person and knows their history, whereas obviously we get called out to them and we don't know who they are or what's wrong with them.
There are many occasions where patients have gone into A&E for an urgent problem, didn't know what their medication was, and they've ended up staying a few days just for the hospital to find out what medication they were on before they could make changes.
It does get worrying when you take so many tablets, and if you'd ever took bad, like if you were into a diabetic attack, like, an hyper, people aren't around you and they don't know what you're doing. I think the summary care records would be a vast improvement. You'd feel better knowing that at a press of a button and a couple of minutes on a computer, and they can have your records, if you're on insulin, what tablets you're on.
One example where this would help us out with, if you go out to a patient who's unconscious, knowing whether they're diabetic or if they've had a stroke, because then the patients are going to react differently to the tests that we do. You need to know what their baseline obs normally for this patient could be.
It's not just emergency staff who stand to gain from access to basic patient details. Out-of-hours and community nurses will also benefit.
Summary care records could help because often patients aren't able to tell the clinicians treating them what treatments they're on and what treatments they've been stopped on. Hello. How are you?
Cheese, please, Louise.
I have one patient who I saw today. She's just been discharged from hospital and they weren't aware of the medications that she was already on. Were the summary care record in place, that wouldn't have happened.
Initially, the summary care record will contain limited but important information. Each PCT is responsible for overseeing the implementation of summary care records in their area. The model for patient consent is one area they'll be working on closely.
The model that we've gone for has incorporated all the learning from our UCL evaluation. Before summary care records are created in an area, all the patients are written to first and given a minimum of 3 months to find out more about it. If patients don't wish to have a summary care record, then they can, of course, say no. But before we look at the summary care record, clinical staff will always ask first, and this is called the explicit consent to view.
While some GPs have welcomed the introduction of summary care records, not all have seen them so favourably.
The first thing we knew about it was that Bolton was going to be the first one in the country to start getting involved. They then ran some engagement events for us to go to, and I went along really from the attitude of great concern, because all I'd read really was what was in the medical press, which was all quite negative. I've got these that have been put on the computer so they can go for filing now. Thank you. I had a lot of worries about patients' records going anywhere outside of our GP practices, really, because I know how important confidentiality is to patients.
There is concern about just who will have access to the summary care record. But for sufferers of long-term conditions, there's more risk involved in relevant members of staff not having access.
For me, in my particular condition, summary care records are a lifeline, really. I find that when you go away and you've got to go in and see a strange doctor who knows nothing about you, it isn't always easy to sort of convey how unwell you are. And also, if you're on lots of medication, if you're not feeling well, you can't always remember them. And the other thing is, because I've got a lung problem, if I've got a chest infection and I can't breathe very well, you can't talk. At least this way, they can access your medication and also any interactions that you've had with drugs or any allergies that you've got, you know, any allergic reactions to drugs.
I came round to the opinion that, in fact, it's not our information that we hold on patients' records, it's the patient's information. So I began to feel that if that's what patients wanted, to share their information, then that was their decision. And that I felt that the opportunity that was going to be given to them to make that decision was being well done. They were all going to be sent an addressed envelope with their name on it, explaining it to them. There was lots of opportunity for people who didn't speak English to find out further information. There was, you know, lots of things in place for people who weren't likely to understand the information. So I was quite happy that people were going to be given the information they needed to make a choice.
All patients over the age of 16 will be sent a personalised letter telling them about the summary care record and pointing them to further information by way of local advice centres, roadshows, the dedicated information line and further printed and online materials.
My first thoughts was that it'd be a very good idea. Especially for me, with several different conditions, that if ever I was in a situation where somebody needed to know, it was all available on the computer.
But an issue that's been a concern for general practice staff is how much extra work will be involved.
Going into this cold, we really didn't know how much work it would be. We didn't know if there would be many patients who would want to discuss things directly with their GP. And we planned for an onslaught.
Being one of the first early adopters of the summary care record, we've had to put a lot of time and effort attending meetings, workshops, working closely with Bolton PCT and other practices to try and make sure that the summary care record takes off. And so it has had quite a bit of impact at the beginning. However, I feel for other practices, I think a lot of the work has already been undertaken. So therefore, it shouldn't really have a big impact on other practices because the systems and the processes should hopefully already be in place.
As a practice, in the first wave of the summary care record, we mail-shotted our patients about 2 or 3 weeks ago. And so far, I'm not aware of any requests for further information on the summary care record at the practice interface. They may well have contacted the PCT through PALS or Communications or the dedicated helpline, but as yet we haven't had any impact on the practice or in terms of a clinician's workload.
Hello, you're through to the NHS Care Records information line. My name's Nikki. Can I take a telephone number that you're calling from, please? I'm an information advisor within a call centre and take most of the calls for summary care records to explain a little bit more about the summary care records and what's involved. So what's the main concern for you at the moment? First point of call would be our helpline. They have our helpline number in the letter. It is safer than internet banking. And they also have further information on the website address that's provided in the letter.
Morning. Afternoon, Mr. Silver.
How are you?
Not too bad yourself?
For some time now, the NHS has been encouraging patients to have more involvement in their own care. Access to their own summary care record will be available through a secure website called HealthSpace.
Okay, righto. Thanks very much. Thanks. I'll see you next time then. Okay, cheers. Ta-ra.
Now, what HealthSpace actually is we're giving a very secure entry through the World Wide Web into the summary care record for patients, first of all, to view only, but in time they'll be able to add information to it, and that clinicians who are looking after them will be able to see the patient entry into the record.
Being able to access my own records on the computer, it's a lot easier than what I do now. I have a list in my wallet of the tablets I take. And I also have a booklet from the anticoagulant clinic, but on the computer it's instant sort of list or things wrong. The information is there up to date.
I think being able to log in and access your what information they hold on you on the health space thing will be very good. I think from a point of view of your own personal feelings, you want to know what information they have got.
I think that there has to be a note of caution in that, you know, some patients might see things that worry them because they might not understand the jargon that's used. But the way we're going to roll out the programme here, I think, covers that. Patients are going to be given a lot of information before their medical conditions are uploaded. But also, I think once their diseases start to be uploaded, if they want that, we're going to give them that information before it's uploaded to check it for accuracy.
As the early adopters gradually roll out the service, the British Medical Association will be keeping a close eye on their progress.
We are very pleased that Connecting for Health has taken on board the recommendations from the UCL evaluation report of the early adopter sites. In particular, the British Medical Association was always concerned regarding the original consent model, and we're pleased that Connecting for Health have taken on board recommendations to revise the consent model. The evaluation report did also highlight that there needs to be much greater work done in raising public awareness in the first place with regards to their records being uploaded onto the spine. What is absolutely vital is that the Summary Care Record Programme commands the confidence of clinicians, commands the confidence of the public and patients, and that the implementation is very much guided through an ongoing process of evaluation and making sure that we actually learn from what actually works and that which is acceptable to clinicians and the public alike.
For many healthcare professionals and NHS patients with complicated medical histories, the transition to Summary Care Records will be very welcome.
I just hope that our doctors does take it on board and gets involved with it, and so we can get organised. And I think every doctors in the country should get on the system and get it working.
I think Summary Care Records are important to me, and they mean a lot to me because obviously I have got a chronic condition, but I also think they're important to other people as well, because people develop conditions at whatever age in life, and it's nice to know that you've got these medical details or these drug details available for other doctors or hospitals to access in the case of an emergency.
GPs need to be aware when they see the patients, they're not bad, they're ill, but it's not in such an emergency situation. And they need to understand that just having a simple name and address and list of medication ready at hand, how it helps us.